Hello, 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 ladies and gentlemen. Welcome back. Welcome to N200. And this is my first lecture with you this semester. And we are talking about community nursing. So these will be positions that are available to RNs in the community, performing various assignments, tasks, gathering information, just anything that is not the traditional nursing role. Let's say that. So, class outcomes for this class. We will apply the concept of community and population to nursing care. We will determine how public health nursing is the foundation of community nursing. We will analyze the reasons for an increased need for nursing in community-based settings. We are going to again talk about the importance of culturally competent care. And I know that you've talked about this because you guys had culture, last year. So we are all aware of culture and how it impacts life, but we also need to remember that it is going to impact how these families, these individuals, make their healthcare decisions based on what is important to them, either by their culture or by their religion. And then we are going to compare and contrast home health care and hospice care. So why? Why? So the U.S. population is aging rapidly, and we know this. We are getting older and older, and the number of older adults is expected to double by the year 2050. Now, this is based on Healthy People 20, which is now 2021, or no, I'm sorry, 2030, because it's every 10 years. So, this, however, is not taking into account the pandemic that we are now experiencing. So these numbers, these statistics, and again, I will never ask you for a number. I am never going to ask you for a statistic. The Board of Nursing is never going to ask you for a statistic. I only bring this up because people are coming home from the hospital sooner, and they are requiring home care a lot more. And when these individuals come home from the hospital, they are on the road to recovery, but that road can sometimes still be a very long road. So hospital stays have now become shorter in an effort to reduce the healthcare costs for the facility, right? Because the longer the patient stays in there, the more it's going to cost the facility. So as a result, community-based healthcare, including home nursing care, is rapidly expanding. So we need to understand the concept of community. So community means a gift or fellowship of common relations and feelings. We are living in and working in places where we have common goals, where our beliefs may be the same. It is common relations and common feelings. So the notion of community will suggest a general sense of selflessness, of sharing, being in relationships, and doing good that comes from working together as a community. So most members of this community will share a common language, they may share certain rituals, and they may share the same customs. So population, ladies and gentlemen, listen up, listen up, listen up. I will never, ever ask you the definition of anything on a test question, on an exam question. However, you need to know what population is in order to respond to my questions. And population refers to a certain geographic region inhabiting a special area, a specific area. It can mean a group of people of a particular race or class in a specified place. For example, there are approximately 1,500 Latino people living in Atlantic City. I don't really know if this is the correct statistic. This is just simply an example. There may be 3,000, there may be 4,000 Latino people living in Atlantic City, but I am just using this as an example, not a statistic. So it can also mean any group of people subject to statistics or other studies. For example, all the homeless people living in Atlantic City, all of the pregnant women living in Atlantic City. The United States Bureau of the Census conducts a survey, and they will count the American people. And so this is the population of the United States every 10 years, and this was most recently done in 2020. So ladies and gentlemen, listen up, listen up, listen up. So when the census is completed, the United States Bureau will group the data into sections of between 1,500 and 8,000 people. And these sections are known as census tracts. And so these maps and these census tracts will show the geopolitical boundaries of a community. So when you are assessing a community as a healthcare nurse, as a public health nurse, as a home care nurse, you need to know where your boundary is for your community. So for example, you need to know the boundaries between Atlantic City and, say, Ventnor, or Atlantic City and Margate, because when we are looking at these numbers and gathering this data, you need to know where that boundary is, where that dividing line is, because somebody who is living on this side of the block might be part of Atlantic City. This side of the block, they may be Ventnor, Margate, Longport. So you need to know your geopolitical boundaries. So an aggregate is a group of individuals with at least one shared characteristic, either personal or environmental. So here in the nursing program, we are aggregates, right? You are a group of individuals that are pursuing becoming registered nurses. So that is at least one shared characteristic, right? So another example is a community health nurse may work with a class of high school girls to reduce the incidence of adolescent pregnancy. So the shared characteristic of this aggregate is that they are female, they are all of childbearing age, and they may attend this particular school. So there's a lot of aggregates there, right? They are all female, they're all of childbearing age, and they attend this particular school. So the components of a community. So structure. Structure is going to refer to the general characteristics of a community. Structure is going to refer to the general characteristics, and this may mean demographic data. So we are looking at gender, we are looking at age, we are looking at ethnicity, we are looking at the level of education, and we are looking at their income. This is all going to refer to structure. And then we are going to look at the data about healthcare services. And this is the number of primary care providers or emergency care facilities in that particular area. And all of this information, again, refers to structure, the general characteristics of a community. So, status. Status is the biological, the emotional, and the social outcome components of a community. So when we are looking at biological data, we are looking at morbidity. Morbidity refers to illness, and then mortality. Mortality is going to refer to the death rate. So we are looking at morbidity and mortality rates, life expectancy ratios, and then risk factor profiles for the respective age groups within this community. And that is all under biological data. Now, emotional data are indications of mental health, consumer satisfaction about various aspects of the community as compared to other locales, as other communities. So, I happen to live in Egg Harbor Township, and if you are a family, maybe a young family, also living in Egg Harbor Township, I find that as far as consumer satisfaction goes, I am very satisfied. It is close to everything. It is close to shopping. It is close for me to get to the beach. All of my family members, I can get there very easily. I have access to main roads. I get to work relatively easily. So all of this are consumer satisfaction, right? And then there is mental health. Well, mental health in South Jersey, I'm not even going to go there. Am I satisfied? Somewhat. So, and then there is social data. And social data are things that you may be looking at when you are looking at places to live, if you're looking to relocate, if you're buying a first-time home. And that would be crime rates, citizenship involvement in community-wide activities. Are there communities where there is an older population? Yes, I think there is. Are there communities where there are younger populations, where there are a lot of new families? Yes. Yes, there are. So when you are thinking about these things, when you're thinking about buying a home, sending your children to school, you are going to look at all of these things because is the school system good? Is there a lot of crime? Is it a relatively safe neighborhood? And is there a lot of activities for my children? Is there a lot of, I'm community and civic minded? Is there a lot of committees, or are there activities that I can become involved with? And this all comes under status and then satisfaction about living in the community that you either are living in or that you are planning on living in. So the process. The process describes the overall effectiveness level of the community. Do the members of the community perceive that they are part of a group with a common purpose, values, or interests? Do I have a lot in common with my neighbors? Do I have a lot in common with the members of my church? Again, I'm civic minded. Are there a lot of activities here? Or, maybe I have young children, and the community that I'm living in, my library doesn't have a story hour for my children, but I want my children to develop a love of reading. I want them to develop a love of sports, and my community is not really good about that. So I need to travel to another community in order to pursue this. What is the extent of interaction among community members? Do I live in a community where, there aren't a lot of civic-minded people, and I have to travel somewhere else in order to partake in a community activity? Does the community have an established forum for conflict resolution? If the crime rate in my community is rising, or if there are incidences where there's teenagers or a younger population, and they might be being a little mischievous, and they're out there and they're, throwing eggs, or flattening tires, or trying to break into cars. What do we do about that? Do we go to the police department? Do I have access to a government or someone that I can talk to that says, "Hey, listen, how are we going to resolve this problem?" So making a community healthy. So when we are community health nurses, when we are public health nurses, it is much different than working in a hospital setting. When you work in a hospital setting, you have your own little group of patients, right? You go in, you have your 5 patients, your 6 patients, and these patients are my responsibility. But when you are in the community, when you are out working in the community, the whole entire community becomes your patient. And that is the difference working inside the hospital, working outside the hospital. So I not only have to think about what's going on with this small group of people when I'm out into the community, then I have to broaden my scope. So when determining what makes a healthy community, the National Census paper, which is Healthy People 2030 now, will provide us with useful guidelines. And these are the guidelines that a community health nurse or a public health nurse is going to use to assess if her community is in fact healthy. The same way we have guidelines and assessment tools that we will use inside the hospital to assess our patients and gauge how healthy they are. So Healthy People 2030 now will identify leading indicators for measuring the health of our nation. And some of these examples will include physical activity, overweight and obesity, tobacco use, smoking, substance abuse, sexual behaviors, mental health, injury and violence, environmental quality, immunizations, and ladies and gentlemen, listen up, listen up, listen up one more time. Access to healthcare, access to primary care services, whether this is your primary care provider, whether this is an emergency room, whether this is an urgent care setting. But access to healthcare and then access to primary care services is a major component of Healthy People 2030 now, which was not much different than Healthy People 2020. So, making a community healthy. So, the 4 overachieving goals of Healthy People 2030 initiatives are to attain high quality, longer lives, free of preventable disease, disability, injury, and then premature death. So we want to keep people healthy. And we are all about prevention, preventable disease. Achieve health equity, eliminate health disparities, and improve the health of all groups. Create social and physical environments that will promote good health for all. And this has been a problem, right, during this pandemic, because we haven't been able to be social. We were able to be social for a little while, and now the numbers are rising and we are back to masking and social distancing, and people are becoming more cautious again. And so our social activities and even our physical environments are again looking a little differently. But if you remember back last year in the lockdown, when we couldn't go anywhere, we couldn't do anything, we were isolated, this created a lot of angst, a lot of anxiety, a lot of mental health issues for a lot of people, because we are primarily social beings, right? And we also want to promote quality of life, healthy development, and then healthy behaviors across all stages of life. So what is going to make a population vulnerable? Well, a vulnerable population is an aggregate, and we said that an aggregate was a group of people that had one shared characteristic, right? So a vulnerable population is an aggregate that has an increased risk for adverse health outcomes. They might have some unhealthy behaviors. Limited economic resources. Income is a major predictor of health risk. Many persons with low income will forego preventative care and seek health care only when they become very ill. And we know this, right? People that don't have insurance, people that don't have very good insurance, people that don't have access to health care. They can't get to an emergency room. They can't get to an urgent care. They don't have a primary health care provider. So they are only going to seek a health care provider when they become very, very ill. And by that time, we are looking at a much bigger problem, something more complex. And then limited social resources Friends and family are valuable resources to help a person deal with day-to-day stress and demands of an illness, right? We need our family around us. We need our friends around us to help us cope, to vent to go through whatever it is we are going through with us. So older adults who live alone and people with mental illnesses are examples of groups at increased risk because of their social isolation. So if you have an elderly population, people elderly who are living in over 55 areas, they're living in senior housing complexes, if they are not friendly with their neighbors, if nobody's coming by and checking on them, no one really knows how ill they are, and they're not reaching out for health care either. So this contributes to their isolation, and therefore it can also affect their mental health. So extremes of age. The very young and the very old are less able to adapt to physiological stress and are at an increased risk of disease. They are more prone to infections, and they may not be able to protect themselves against environmental hazards such as heat or cold, right? Because as we age, the older population, they are more sensitive to heat and cold, but they don't feel it as readily. Babies the same. So these age groups are also more often living in poverty. Chronic disease and obesity. People who have chronic diseases, diabetes, asthma, hypertension, are at a greater risk of health problems. So, history of abuse or trauma. People who have experienced abuse or traumatic events often feel they have limited control over their health and circumstance. Abuse and trauma also stress a person's ability to cope, placing them at risk for physical and, again, mental health problems. So, understanding the concept of community-based nursing. So, a community can either be a site for healthcare delivery, a hospital, an urgent care, a health complex, or a recipient of healthcare services. So community-based care is going to refer to healthcare or rehabilitative services performed in clinics, offices, mobile care units, and other facilities in the community rather than acute care settings such as hospitals. So, simplistically saying, what I am saying is if you are in a hospital and if you are performing care in a hospital, that is acute care. Once you step out of that hospital, you are now community-based. So, if you are in the hospital and you are taking care of your patients, you are considered in an acute care setting. If you go to that parking lot and if you set up some tables and if you have some literature and if you are conducting blood pressure screenings or blood sugar screenings or offering information about prenatal care, you are now community-based because you are no longer dealing with the population that is within that building. You are now out in the community and serving the community. So community health nursing focuses on how the health of individuals, families, and groups are going to affect the community as a whole. The community health nurse will strive to promote, protect, preserve, and maintain the health of the population through the delivery of personal health services to individuals, families, and groups. Ladies and gentlemen, listen up, and then listen up for me one more time. Public health nursing focuses on the community as a whole and the eventual effect of the community's health status on the health of individuals, families, and groups. So, the goal of the public health nurse, is to prevent individual disease and disability in addition to promoting and protecting the overall health of the community. So again, public health nursing, my patient is my community. That becomes my patient. I am looking at the overall health of this community. So today's public health nurses function in a health promotion role. They must possess skills such as community assessment. They must be culturally competent. They may be able to plan a program. They have good communication skills. They need to be able to financially plan and manage these services that I want to offer to my community. Who's going to pay? Who is going to pay for this service that I want to offer my community? And then how am I going to deliver it? How am I going to manage getting this information out to my community? Leadership, systems thinking, and then policy development. So they wear an awful lot of hats. For example, a public health nurse may be employed by a county health department to provide surveillance services to monitor for TB, tuberculosis. The nurse is going to protect the entire community by screening for TB at the local school, by testing high-risk individuals for TB, and by identifying and tracking clients with active disease to ensure that they complete the prescribed 6 to 9 month medication regimen. So the same way that I would do this for 1 or 2 of my patients in a hospital setting, I now have to look at this on a broader scale. So I am not just taking care of 5 or 6 people. I am taking care of everyone that lives in my community. So again, this may go back to my census tract and my boundaries, my geopolitical boundaries, because I only have to worry about my community, right? My community. So because public health focuses on large-scale programs for the entire community, government-based agencies often provide services. The United States Public Health Service is an example of a public health agency within the federal government. So, when we are talking about public health nursing, we are talking about the federal government. Does that make sense to you? Whenever I am talking about public health nursing, this is a federal position. I am working for the government. Examples of successful health programs are human papillomavirus immunizations for adolescents, that is the HPV vaccine, smoking cessation programs, motor vehicle and infant car seat safety instruction, and obesity prevention programs for children. So when we're talking about public health nursing, we are talking about the federal government. So now let us think about community-oriented nursing. Community-oriented nursing combines components of community and public health, and this is where the two are going to merge, where the two are going to work together, so to speak. Focus is going to be on health promotion, illness prevention, early detection, and treatment provided within the community setting. Practice is evidence-based because I am a nurse and I am evidence-based, and collaborative with other community health disciplines. So the approach is going to be a comprehensive look at the individual, the family, the group, and then the community at large. For example, a nurse with a community-oriented approach might work in an adolescent prenatal program. So the nurse is going to provide individual care at the local clinic for 2 days a week. While at the clinic, she is going to gather data from adolescents about the schools they attend, as well as their knowledge of birth control, pregnancy, and childbirth. Because remember, part of the role of the community health nurse is to gather data. That is part of my role. So then on the other 3 days, I can meet with school officials to identify these pregnant teens who are going to need prenatal care. I might teach a class about sexuality in the local high school. I may work with teachers to identify strategies to keep pregnant teens in school. And here you can see where community-oriented nursing, community health nursing, and public health nursing are going to merge. And community health nursing, I am looking at the individual, then I'm looking at how that is affecting the family, and then I'm looking at these families as a group. And then if I am public health nursing, I am looking at the health of the community as a whole. So as a community health nurse, maybe working within a school system, I may identify that I have a lot of sexually active children or teenagers, young adults within my school systems. So because they are sexually active, now I have to think about pregnancy, I have to think about sexually transmitted diseases, and say that I discover through gathering my data and through some testing that there is a lot of incidents of STDs in one particular locale. Well, because this is something now bigger than me, because it might be the Egg Harbor Township school system, then it may be the Absecon school system, it might be the Margate school system. So now this is something where I might have to reach out to a public health nurse and say, listen, I'm in Egg Harbor Township and I discovered this, and I was talking to the school nurse in Absecon, and she's got the same thing going on, and we reached out to Ventnor, Margate, Longport, and Margate is in the same boat we are. So there's something going on here, and then that is when it would become a public health issue and not just a community, because it is affecting more than one community. So just a little bit of history here, the pioneers of community nursing. Florence Nightingale. Florence Nightingale established the importance of promoting health by manipulating the environment. She was the first holistic nurse. So she focused on light. Is the patient comfortable? Are they warm enough? Are they cold? Are they comfortable in their position? Do they want to get out of bed, sit in the chair? Sanitation, is the room clean? Are they clean? And again, nursing the whole person, looking at the person as a whole. She was the first holistic nurse. Lillian Wald. Lillian Wald is known as the first community health nurse, founded the first Visiting Nurses Association in New York. So she was the first nurse to go out and teach nurses how to take care of people in their home. Clara Burton. Clara Burton was the founder of the American Red Cross. Margaret Sanger. Margaret Sanger founded the International Planned Parenthood Federation, and she pioneered the use of family planning and birth control education. So working within communities, the community nurses' roles vary depending on the community and its identified needs. So working within communities, community nurses' roles vary depending on the community and its identified needs. One of the most effective nursing interventions is empowerment. Empowerment. And empowerment is assisting the client, whether it is an individual or the community as a whole, to recognize and use available resources to achieve or maintain the desired level of health, achieve autonomy, and maintain a positive self-esteem. So the roles of community nurses: client advocate. The effective community health nurse consistently supports the identified or expressed concerns of the client and or community. So as a community health nurse, you can affect change by getting involved in your local student nurses association, professional nursing organizations, the school board, and citizen committees, or by attending council meetings. And again, these are all community-based things that the community nurse is a part of, because the community as a whole may look to a nurse or a nursing professional for guidance. Educator. We know that we're educators because every single time we walk into a room, we are educating the patient or the client about something, right? Because community nursing focuses on wellness and disease prevention, much of what the nurse does involves education of individual clients, groups of people at risk of disease, politicians, or a community. So the most effective educational programs are concise, providing relevant, practical information, and can be easily incorporated into the learner's daily routine. Collaborator. Ladies and gentlemen, listen up, listen up, listen up. Collaborator. An example of a collaborator is a community health nurse that is concerned about poor compliance with the recommended immunization schedules for 2-year-olds in her local community. So after surveying some of her parents, the nurse discovers that this particular clinic's operating hours are limited and the automated call routing system is frustrating for people trying to set up an appointment, so therefore they don't set up an appointment. And then there we go. I don't know how this happens, but the clinic does not offer online scheduling. So the nurse also discovers that this clinic does not email or text reminders to clients, nor follow up to reschedule missed appointments. So, ladies and gentlemen, listen up, listen up, listen up. This nurse will then schedule a meeting with the clinic staff, with managers, and then patients. We're going to involve the patients because that's who we serve, to resolve these issues. And we are going to build partnerships and affiliations that will effectively address common concerns, and then we are going to work toward a resolution. And so, ladies and gentlemen, if we stop and think for a moment, is this not the nursing process? So please take into account, just because we are talking about community, the nursing process does not go away. We are still going to utilize the nursing process. So, counselor. Once you have established rapport with the group, members may consult you, the counselor, the nurse, about a variety of health-related and some non-health-related concerns. So be careful to offer counsel only within your scope of practice. You need to stay within your scope of practice and make recommendations that are practical yet meet the needs of the community. So we are walking a very fine line there, right? You may need only to serve as a witness to the group's concerns. So allowing clients to discuss or work through these issues will again give them empowerment, and then they can foster self-reliance, right? So I'm going to vent to you. I am going to talk about what is bothering me. And then as we're talking about it, I might be able to brainstorm on my own, look at things a little differently because I'm talking about it out loud. And I might be able to say, well, maybe I can try this, maybe I can try that. So this gives me an empowered sense of, yes, I can do this. I can figure this out on my own, and I can handle this on my own. So in the clinic, going back to the clinic now, in such a clinic, the appointment times will fill up quickly, and often clients must wait more than a month or two for an appointment. So before enrolling these families in the program, you would need to make them aware of these limitations and share this information so that they know, well, if I'm going to make an appointment, it's going to be at least 2 months before I'm going to be seen. So maybe I want to make an appointment somewhere else. Or if this is the only clinic that is available to me, and so now if this is really becoming a problem, then maybe we need to go back and think about why it is taking 2 months for clients to be seen. So, and this should also not be new information to you, but there are 3 basic levels of care in which nursing interventions can be classified, and that is primary, secondary, and tertiary. So most community-oriented nursing practices are aimed at the primary, and primary is prevention. And that is very easy to remember, right? Because they're both P's. Primary, prevention, both P's. Primary interventions, the goal of primary, which is the first level intervention, is to promote health and prevent disease. So again, primary, prevention, both P's. Primary interventions will include educating someone, collaborating with other areas, and then civic involvement. Education is directed at susceptible individuals with no known disease process, right? Because we want to make sure that they're aware, and then we want to make sure that they understand the education so that they can see something coming down the road. For example, a nurse may educate women of childbearing age to wear insect repellent if they are traveling to a location where there is mosquitoes, and because these mosquitoes can carry the Zika virus, right? So, pregnant, not pregnant, you just need to be aware that, if you're going to go to an area where there might be mosquitoes, that you need to know that there is this mosquito out there. Collaborating with local agencies to provide clean and secure temporary housing for migrant farm workers, right? We want to keep them healthy. Civic involvement, lobbying elected representatives for a ban on e-cigarettes in adolescents. And this is a horrible, horrible topic for me. I do get on my soapbox, and so I am just going to stop right now. So, but yes, I really think that there should be a really big ban on e-cigarettes. Secondary interventions. Secondary, very easy to remember. Secondary screening. This is when we do our screening. So secondary screening, both S's, right? Primary prevention, both P's. Secondary screening, both S's. And this is to aim to reduce the impact of the disease process by early detection and treatment. Again, we are screening. For example, a community health nurse may screen a sexually active adolescent girl for hepatitis B and/or HPV, the human papillomavirus. She has known risk factors for sexually transmitted infections, but she has no disease symptoms right now, right? She is sexually active. She is not practicing safe sex, so she has a lot of risk factors. So the nurse will teach the client how to protect herself from STIs, sexually transmitted infections, hepatitis B, and HIV for the future. Other examples of secondary interventions include providing outreach screening programs about mammography, scoliosis screening, lipid testing, and then prostate-specific antigen testing for prostate cancer for men. So again, screening, secondary, both S's. Tertiary. Tertiary. When we're talking about tertiary, we are going to do a lot of teaching. A lot of teaching. But we are going to do this teaching, this education, after the disease process. This is not education that would become with prevention, okay, where I'm going to talk to you about how to prevent something. Tertiary is a third level intervention to halt disease progression and to restore client functioning to the pre-disease state. So this is patient education after the fact. So tertiary is again teaching both T's. So primary interventions is prevention. We are going to talk about how to prevent something that might be coming down the road, both P's. Secondary, we are going to be talking about screening, both S's. And then tertiary, it is going to be teaching, but it is going to be post. It is going to be patient education post. So the nurse is required to collaborate with members of other healthcare providers to provide treatment. For example, a student may report to the school nurse that she has been involved in unprotected sexual activities. So the nurse is going to refer the student to the public health clinic, because this is not something that I do at school, for a pelvic exam and lab testing to detect the STI, hepatitis B, HPV, and do an HIV screening. The student has an abnormal pap smear suggestive of an HPV exposure. So the clinic nurse, in collaboration with the provider, is going to administer any required medical treatment. There is no cure for HPV, so the teen also needs to learn how to prevent the spread of the disease to others and obtain regular pap and pelvic exams to detect cervical cancer and then other possible sexually transmitted infections. So some career opportunities for community-based nurses, because we are all over the place. You can actually do anything these days and still be a nurse. There is school nursing. This is nursing practice in the school setting, and this began when educators realized that children with health problems had more difficulty learning. So the core focus is keeping students healthy and in school, as school attendance is essential for academic success. And we know this even with you, right? You need to come to class, you need to be present in lab, you need to be present in the classroom in order to learn and be successful. So school nursing provides direct care for children with chronic health conditions such as asthma, attention deficit disorder, and diabetes. They will help children who need routine procedures such as a neb treatment or a blood sugar check. They will perform vision and hearing screenings, and they will ensure that age-appropriate immunizations are documented. They may offer health education on topics such as nutrition, physical activity, and sexual and reproductive health. They may serve as role models for students who lack parental support or who are struggling with peer pressure. A school nurse, one of the traits of a school nurse is she needs to be incredibly autonomous because she essentially works alone, and she must be capable of prioritizing and making decisions. So occupational health. Occupational health nurses work primarily in industrial or corporate settings. They will provide health promotion programs for employees and their families in an effort to reduce absentee hours, increase productivity, and reduce illness and complications. They will complete required medical documentation for disability claims or occupational hazard events, and they will conduct new hire and annual screenings. They will provide care to injured or ill workers. They may be required to obtain random drug testing, and they will assist in filing workers' compensation claims. Parish nursing. Parish nursing is a specialized area of nursing practices that is going to focus on the promotion of health within the context of the value, beliefs, and practices of a faith-based community. They will act as a health educator and personal health counselor, increasing awareness of the relationship between lifestyle, their personal habits, their health attitudes, and their spiritual beliefs. They can develop support groups, they can train volunteers, and they can provide community referrals as needed. Correctional facilities. Corrections nurses deliver health care within the criminal justice system, for example, in juvenile detention, substance abuse treatment facilities, and in some prisons. They will provide primary care services to people of all ages in an unbiased and non-judgmental manner. They may also perform occupational health duties for the facility staff. So for personal safety, nurses must meet certain physical requirements and complete special weapons training before working in most correctional facilities. This is not a position that is for me. It does involve a high level of autonomy, and they are commonly involved in policy decisions involving inmate health care. So public health clinics, many community health nurses will practice within local and state departments of health, including public health clinics. Large cities will tend to have nurses who specialize, so immunization clinics, prenatal clinics, school health clinics, and then smaller communities may have fewer nurses, and because there are fewer nurses, these nurses will have broader services, so they will do everything. So disaster services nursing. A disaster is any event or catastrophe inflicting widespread loss of life, diminished health, and destruction of property. So their duties may include rapidly assessing the overall situation and that of individual victims, triaging care and initiating life-saving measures, adapting nursing skills to the disaster situation, considering available equipment, supplies, and the personnel that are on hand, evaluating the safety of the environment and removing any health hazards, and then providing leadership in coordinating the care, assigning priorities for care, and then transporting victims. They are responsible for preventing further illness or injury, and they provide compassionate support to victims and their families. Culturally competent care. Now, I am not going to spend a lot of time talking about culturally competent care. I just want to review because I know that you've already had all of this information. So the term cultural awareness, cultural sensitivity, and cultural competence are often used interchangeably, but they are not the same. They are not the same. Cultural awareness refers to an appreciation of the external signs of diversity. Ladies and gentlemen, listen up, and then listen up one more time. Cultural sensitivity has more to do with personal attitudes and being careful not to say or do something that might be offensive to someone of a different culture. It is being respectful of their attitudes, of their beliefs, of their faith. Cultural competence is achieved on a continuum ranging from incompetent to competent. And the Purnell model for cultural competence will stress teamwork in providing culturally sensitive and competent care to improve outcomes for individuals, families, and communities. Now, in my book, in the Trees book, this was on page 322, if you have access to the book. Purnell's model will define cultural competence as adapting care to be congruent with the patient's culture. So again, we want to do something that is going to be respectful of the patient's culture. The model identified levels of several levels of cultural competence. So unconscious incompetence is not being aware that you lack knowledge about another culture. I'm totally oblivious. Conscious incompetence is being aware that you lack knowledge about another culture. Conscious competence is learning about the client's culture and providing culture-specific interventions. Ladies and gentlemen, listen up, listen up, listen up one more time. Conscious competence is learning about the client's culture and providing culture-specific interventions. Unconscious competence is automatically providing culturally congruent care to clients of diverse cultures. So, there are some barriers to providing culturally competent care. So, there may be a bias. A bias is a lack of impartiality. It can be positive or negative. Ethnocentrism is the tendency of people to believe their own beliefs and their values are right and those of other cultures are just plain wrong. Cultural stereotype is the unsubstantiated belief that all people of a certain racial or ethnic group are alike in certain respects, and this can be positive or negative. Prejudice. Prejudice is a negative attitude toward other people based on faulty and rigid stereotypes about race, gender, sexual orientation, and status. And then discrimination. Discrimination is the behavioral manifestations of a prejudice, and this is refusing to provide services or opportunities to a certain racial or ethnic group. So, racism. Racism is a form of prejudice and discrimination based on the belief that race is the principal determining factor of human traits and capabilities. Racial differences produce an inherent superiority. And this term, obviously, especially in these times, can now provoke powerful emotional responses. Sexism. Sexism is the assumption that members of one sex are superior to those of the other sex. An example of this is male chauvinism, and this is the assumption of male superiority, and that is common in many cultures, and it may be very subtle or may be very noticeable, very overt. So language barriers, and this happens a lot. More than 60 million people in the United States will speak a language other than English in their own home. And this may affect your ability to communicate with your clients. Street talk, slang, and jargon, these vocabularies can be very challenging. And then there is the healthcare jargon. And I know that you've already talked about this, where terminology and abbreviations clients may not exactly understand, so they need things spelled out for them. It needs to be on their level. We need to begin to talk to them where they live, where they are. Hospice nurses. So let's talk about hospice. Hospice nursing focuses on cares of patients who are dying, excuse me, or whose condition is not expected to improve. So services are provided in the patient's home, in the hospital, in nursing homes, and in homes that are specifically designed for end-of-life care, hospice homes. I don't believe that we have any right now in New Jersey. If we do, I am not aware of them. The goal of hospice care is to promote comfort and quality of life. The focus is going to be on providing comfort and managing symptoms. So as a direct care provider, the hospice nurse will assess the client's condition and then monitor responses to interventions aimed at relieving distress. Again, ladies and gentlemen, the nursing process at work. So as an educator, the hospice nurse will teach the client and the family how to adjust medications and to care for and control pain and other symptoms that the client may be experiencing. So the roles of communicator and then client advocate assume prime importance because the client may not be able to speak for themselves. So it will come for the nurse to speak for that client. So the future of home healthcare, let's just talk a little bit about this. Healthcare analysts have predicted several changes in home care during the next few decades moving forward. Increased need for home healthcare. It is more cost effective to provide healthcare in the home rather than an inpatient setting because it costs the facilities a lot of money to keep the patient in the hospital, in the facility. Increased use of home care for hospice care. Public acceptance of the home as a place of comfort and care, as well as the cost of inpatient care, has increased the number of persons who choose this compassionate option for end-of-life care. So increased technological advances such as online resources or telemedicine consultation make it safer and more affordable to deliver complex care in the home, right? Because we can do it on our computer, we can do it on our phone, and allowing home health nurses to deliver information and then therefore provide support. And it also allows us to continue to do research. So in the life of a home healthcare nurse, the days will vary. The caseload may be contained within a limited geographic boundary. Remember, we talked about those geopolitical boundaries to be more efficient. So if you work for a company, Bayada, Compassionate Care, a hospice company, they will try and limit you so that your drive time is minimal. So that gives you more time with your client, more time with your patient. However, that is not always possible. So the objective of the home health care nurse, ladies and gentlemen, listen up, listen up, listen up one more time. The objective of the home health care nurse is to develop a rapport with the client and the family and establish trust. That is the main objective, the first objective of the home health care nurse. So how do we go about making this visit, going to this patient's home? Well, before the visit, ladies and gentlemen, listen up, and then listen up one more time. Before I go to this visit, I am going to look at the client's chart and the referral form to determine why am I even going? Why am I going to this client's home? Why am I seeing this client? Then I'm going to look at the client's healthcare problem, any medications that they're on. I'm going to look at the treatment plan, and then I am going to call the client to see if they are even available for a visit on that day. Right? So why am I going there? And then are they even available for that day? And then, because I need to be organized, right? It's not like we're in the hospital setting, and if I forget to bring something into the room, I can just call someone or I can just leave the room and go to the supply room and get what I need. That's not going to be possible. I have to have everything that I need with me when I am going to this visit. So I need to review any supplies that I may need and make sure that I have them with me. So I'm going to look for teaching materials. I am going to establish a goal for the visit. What do I want to accomplish at this visit? And then I'm going to make sure that I have all of the supplies that I need. So therefore, I am going to make sure that my equipment bag is stocked with the supplies needed to meet the needs of my client for that visit. And then I am going to make sure that I am safe in doing this visit and going to this home. So in order to provide for my personal safety, I am going to inform the health agency how I'm going to get there and where I am going and the time that I am going to be there. When you get there, if you sense danger, if there is a family dynamic going on, if you're pulling up into a neighborhood and the neighborhood is not safe, if you do not get a feeling of safety, you're not going to get out of your car. And then you are always, always, always going to carry your cell phone with you. So, one of the things that we talk about in home care is medication management. So, one of the Joint Commission 2016 safety goals for home care is to use these medications safely. So, this will include preventing errors with look-alike and sound-alike medications. The client needs to be aware, educating clients about anticoagulant therapy, keeping a list and reconciling medications when a client transfers from one agency to another, or when they go to the doctor. When they go to the doctor and the doctor says, okay, stop taking this medication, but I'm going to increase this medication. So we need to be able to reconcile that so that we are doing the proper medication administration for this client in the home. So older adults, if the adult is older, we can involve family members in the care of the older adult as needed, including giving these medications. Older adults and sometimes caregivers may have difficulty remembering when to take their pills, which ones to take, and even whether they have already taken them. So sometimes charts, setting reminders, putting information on the refrigerator, all are steps that we can take to make sure that they are remembering to take their medications. So the medication organizer, the pill box, ladies and gentlemen, listen up, and then listen up one more time. The nurse, the home care nurse, may suggest a medication organizer with a compartment for each day of the week, right? 7 compartments. The nurse may need to prepare a week's worth of oral medications for them during a visit, so I'm going to prepare this for a week. So now I need to assess, does the patient know when to take these medications? Are there reminders? Are they in fact remembering? Are they taking the proper medications? So the nurse may need to return in a day or two to evaluate whether or not the patient is being compliant with taking these medications. So the home care nurse is focused on an individual patient, and the primary goal is to have the patient function as well as possible. Ladies and gentlemen, thank you. Thank you for your time. Thank you for your attention. And as always, if there are any questions, comments, concerns, issues, please reach out. See you soon.